Shoulder dystocia is persistent anterior-posterior location of the fetal shoulders at the pelvic brim. It typically occurs when the anterior shoulders are impacted behind the pubic symphysis. You may see a turtle sign where the head delivers and then retracts back into the vagina. Diagnosis should be made if you fail to deliver the fetal shoulders with gentle downward traction on the fetal head, requiring additional obstetric maneuvers to effect delivery. The patients at risk of suffering shoulder dystocia include diabetics, increased birth weight, shoulder dystocia in a previous delivery, operative vaginal delivery, prolonged second stage, pre-state labor and delivery, postpartum pregnancy, maternal obesity, or excess weight gain. Majority are not predicted and have no risk factors, so you need to be ready for shoulder dystocia with any patient. Upon diagnosis, stop pushing, call for help, lower the bed, and have someone to help you during the maneuvers. The following videos are going to demonstrate a few common maneuvers that will effect delivery in case of shoulder dystocia. The Mark Roberts maneuver should be used first because it's simple, logical, and effective. The procedure involves two assistants who each grasps a maternal leg and sharply flex the thigh back against the mother's abdomen. It results into cephalad rotation of the symphysis pubis and flattening of the lumbar lordosis that can free the impacted shoulder. If Mark Roberts maneuver does not deliver the baby, you can apply suprapubic pressure in the direction away from the fetal back to disimpact the anterior shoulder. Do not apply fundal pressure. The next maneuver, if Mark Roberts and suprapubic pressure are not successful, is delivery of the posterior arm. You place your hand in the posterior vagina and locate the posterior arm and bend at the elbow, sweeping the arm across the front of the body over the baby's face. Do not pull via the humerus or it may cause a humeral fracture. The next maneuver is a rotational maneuvers, including the Rubin's maneuver. So here you place your hand on the back surface of the posterior shoulder, rotate it anteriorly towards the fetal chest or face. Another rotation maneuver is the Wood's corkscrew maneuver. Here you place pressure on the anterior clavicular surface of the posterior shoulder, rotate it until the anterior shoulder dislodges from behind the pubic symphysis. It is the opposite of the Rubin's maneuver. The other maneuver is the Gaskini maneuver. This can be done in a woman who can move. So we ask the woman to go on all fours. This increases pelvic dimensions and shifts fetal positions. Gentle downward pressure on the posterior shoulder combined with rotational maneuvers can allow you to deliver the posterior arm.